is Laura Klein. I'm the National Milk Research Leader at Australian Red Cross Lifeblood. I'm based in Alexandria, New South Wales, Australia. I'm trained as a biological anthropologist. I got my PhD at Harvard University looking at the milk composition across global populations. After that, I moved on to the University of Illinois at Chicago, where I taught anthropology classes to undergraduates primarily, before moving in 2019 to Australia to help establish a research program at Lifeblood to better understand how donated breast milk could be used to help improve outcomes for vulnerable babies. My research focus is really around donated breast milk, from the time that a donor makes a decision to donate her milk to the time that that milk leaves our facilities to go to a hospital where it's fed to a vulnerable or preterm baby. One of our priorities for the next year is collaborating on a clinical trial to understand if donor milk can have benefits for babies that are born moderate to late preterm, or 32 to 36 weeks gestation. Currently, most of the donated milk that's provided to hospitals in Australia is used to feed babies that are born less than 32 weeks gestation, because that's where there's the greatest evidence of benefit, that for those babies, when they don't have access to their mum's own milk, having access to pasteurized donor human milk helps reduce the risk of necrotizing enterocolitis, which is a very serious and often fatal gut disease. Donated breast milk is a very precious gift, and having the evidence to inform care practices helps us best understand how to use that gift to improve outcomes for Australia's tiniest patients. We know that mother's own milk is the best source of nutrition for infants, but donated breast milk actually isn't the same as mother's own milk. Mother's own milk is a complex fluid that's shaped by interactions between a mom and her infant, both physiologically and behaviorally. But donated breast milk is actually something different, because donated breast milk is milk that's generously given by one mother to feed another infant. And there's a ton that we still don't know about the best ways that we can collect and process and distribute this to help preterm and vulnerable infants get the best health outcomes that we can. So this is a really exciting area of work due to the number of questions that we have, as well as now with Australian Red Cross Lifeblood operating a milk bank service in Australia. We have the unique opportunity to be able to not only meet the demand for supply to those very vulnerable preterm infants that we know it helps, but we also have the opportunity to support clinical trials and to do laboratory research into new and different ways that we can use this valuable gift. What gets me up in the morning to start my day is that I get to collaborate with different researchers and clinicians across Australia, all of whom are coming to these projects with wildly different perspectives on donated milk. So in a day, I might meet with infant nutritionists at SAMRE, or a dairy researcher at the University of Queensland, or someone interested in drug delivery methods at Monash. And all of them are thinking about ways that we can use donated breast milk to help vulnerable infants in vastly different ways. And those different perspectives and bringing those different ideas together is what really gets me excited. Outside of work, I really enjoy going for bike rides and doing yoga, as well as exploring lots of different places around Australia. I've had the opportunity to move here around 4 years ago and still feel like there's many parts of this beautiful country that I haven't had the chance to see yet, but that I would really like to.